Mr. President, I am a young Nigerian who has only lived on this soil for just a little above 1.5 decades. As a peer health educator, I have seen and read a bit about what damage HIV/AIDS can do to a people. Mr. President, the little time I have been given for this address will not allow me to tell my stories in full. Because of this, I want to request you to permit me to tell 2 stories that have touched my heart. Olu is an AIDS orphan who lives in our neighborhood. He is my age, but lost his parents when he was only 9 years old. He had since then known no parental care. He walks around very unhappy and is always looking sad. Our community has been very unfriendly and harsh to him. We are not even allowed to play with him. Olu dropped out of school and now sells firewood to earn a living. I have read the story of Awalu Ibrahim, who resides in Kano in northern Nigeria. Awalu is 24 years old. His parents died of AIDS, leaving 9 children behind. Soon after their mother's death, the youngest child also died. His mother's last wish was that the children should not be separated. Awalu, as the eldest son, decided that he would do his best to fulfill their mother's wish. Awalu collects old iron beds, breaks them up, and resells them to earn enough to feed his brothers and sisters. He leaves home before 6 every morning to trade and rushes back home with whatever money he had made by 10 or 11 same morning to give the young ones breakfast. If he does not earn enough to buy food, the family goes hungry that day. The burden of this work is already affecting the young man. How I understand Awalu could not make it to this place today, but his younger brother, Absalam Ibrahim, is here with us. Children affected by AIDS in our communities are faced with a lot of problems. When they are ill, they cannot access drugs for the treatment of their condition. They do not have enough to eat. They do not have enough clothing. And they do not have access to education. Each time I think of children affected by AIDS, I ask myself, is this all that life has to offer them? Mr. President of the United States, Mr. President of Nigeria, I speak for millions of children affected by AIDS in Nigeria and Africa. Like a young person, I cannot yet do much to support my country in the area of production. But as we have been taught, we young people are the future of our country, and we are most affected by HIV and AIDS. Yet, we want to live. We want to live to assist our country grow. We need your help to do this. With your help, we shall win the war. God bless you, Mr. President. God bless America. God bless Nigeria. Distinguished guests, I have the honor and privilege to invite the President of our dear nation, His Excellency, President Olusegun Obasanjo, to address this gathering.
Mr. President, distinguished ladies and gentlemen, if any of us has not been touched by anything, we must be touched by a tire story of children like her who need love, who need care, who need to be looked after. And it is in recognition of this that this administration took the decision to set up at the highest level of government a committee that will deal with the scourge of HIV/AIDS by setting up a cabinet committee of ministers, which I have the honor of chairing, so that all that it takes can be given to make sure that even when we know that this is an incurable disease, we can make those who have it live and be loved and be cared for, because that is what we can do. And that is what we should do. And that is what we will do. We must not do less, and we will not do less. I only want to thank President Clinton for making a point and insisting to make this an item on the program of his visit to Nigeria. We are so concerned because it is not a disease that you can say if you eradicate in Nigeria, then it's eradicated for good. Those who from Nigeria go outside and have sexual relations with those who have AIDS, HIV/AIDS, or have blood transfusion from them, can bring back. And we do not see it as a Nigerian disease alone. We see it as a world disease, but which is ravaging Africa most. A world disease which is ravaging Africa most. And therefore, we in Africa must do what it takes to care, to stop the spread of this disease. We must raise awareness, and we must make it clear to our people that it's not a contagious disease. And those who are diagnosed HIV positive can still live normal life among the members of their family and their fellow human beings. And in fact, they must live among the members of their family. And it is this realization that we have to work together in Africa to fight the scourge of HIV/AIDS that made me, during the OAU summit in Lome this year, to ask OAU to come along with us so that we can have a summit conference in Africa on HIV/AIDS next year. It is serious enough to be given attention by African leaders. It demands no less. And that we will give it. Tayo, once again, I feel the way you feel for children like you who are caught in this terrible disease. But we want to let them know that there's hope for them. We want to let them know that those who have not been able to go to school, who are still within the ages of going to school, will have free, not just free, but compulsory education. We want to let them know that we love them and we care for them. Thank you.
Good afternoon, Mr. President. Good afternoon, ladies and gentlemen. Mr. President, I am an adult living with AIDS. I used to think there was no hope for those of us living in this country. But my perception of the future has been changed. We can see silver lining at the end of the tunnel. I wish to applaud President Olusegun Obasanjo for his dedication to fight HIV/AIDS in Nigeria. For the first time in this country, we have a president that has openly acknowledged AIDS is a problem and has dedicated and has decided to lead the fight against it. But the size of the problem in Nigeria is huge and looks suffocating. Distinguished guests, this is my story. My wife and I lived together from January 1995 after our traditional wedding and got a date in April of the same year for our church wedding. But part of the conditions to be met before marriage in the Catholic Church in Onitsha, where I stay, include HIV antibody test, genotype, and blood group. And without counseling, and without post-test counseling, my wife and I took HIV antibody test, and the result was positive for my wife and negative for me. The church made efforts to discourage the wedding, but we insisted. First, the church announced the revocation of the wedding, When we insisted, our parents were invited. The priest asked our parents if they knew our status. They said yes. The church took time to explain the implications to our parents, and they still supported the marriage. The church thereafter wedded us. After wedding, we became close to the Archbishop and all the Reverend Fathers involved. The Archbishop then referred us to an Argentine missionary doctor, Susie Kodazi, who was then implementing the Family Health International's community home-based care support in Onitsha, funded by the United States Agency for International Development. Our situation improved with the counseling and home visits by outreach workers on the home-based care project. Today, I am a program officer on the Care and Support Project. In 1995, my wife won the American lottery visa. We were then referred to St. Nicholas Hospital in Lagos by the American Embassy for medical tests that include HIV antibody tests. My wife tested positive again. Here, I tested positive for the first time. We presented the documents at the American Embassy, and we are informed that we could not be given visa on the basis of our status. Soon after this, a national meeting of people living with HIV/AIDS was convened in Ibadan. It was at this meeting that I was elected the national president. I granted press interviews, which were widely published in Nigerian dailies. My employers got the information and terminated my appointment, giving me 2 months' salary in lieu of notice. Then I became more involved in the Care and Support Project. During this period, my wife became pregnant. Dr. Kodazi requested for my wife's billing methods record and realized that we kept it faithfully. She advised that we should keep the pregnancy and pray also daily. Then came the 12th World AIDS Conference in Geneva in 1998. USAID, through FHI, supported me to attend the conference. It was an eye-opener. It was at this conference that I learned more about the possibility of preventing mother-to-child transmission of HIV. I saved enough money from my feeding allowance to buy antiretrovirals for my wife and the baby. In Onitsha, we had a long-drawn battle with the hospital staff to provide my wife care. They abandoned her because of her HIV status. It was discouraging, but we persisted. My wife had a cesarean section to further protect the baby. The baby was delivered October 8, 1998. My wife is here with me today, and our baby at 18 months plus is still seronegative. Mr. President, the problem of people living with HIV/AIDS are indeed basic and fundamental. While a lot can be achieved with effective home-based care for people living with HIV/AIDS, this level of care is not readily available. Protecting people living with HIV/AIDS from retrenchment and dismissal from work when diagnosed will go a long way to keep hope alive. Mr. President, I do not wish to bore you with many requests, but only to say that we request your support for advocacy to break the silence and denial at different levels of decision-making. We request your support in the area of advocacy to discourage stigma and halt discrimination. Drugs that will prevent children from being infected in pregnancy should be made available, affordable, and easily accessible. Mr. President of the United States, you can do something today that will change the entire course of AIDS pandemic in our world. With you as an advocate on our side, governments in Africa will do more than they are currently doing. Just as you have touched many homes and hearts in Africa with your good works in the area of health, I call on you today to touch the hearts of all ailing people living with HIV/AIDS with your soothing hands. The war against AIDS can be won if we all come together, like the theme of this event. Nigeria and the United States joining forces against HIV/AIDS. These are my requests, and they are a summary of my story. God bless you. God bless America. God bless Nigeria. Distinguished guests, I have the special privilege to invite the President of the United States, Bill Clinton, to make his remark. Thank you.
Thank you very much. Thank you. Thank you. Thank you very much, Mr. President, John and Toya. Thank you very much. I would also like to acknowledge the presence here of Minister of Women's Affairs Ismail, Dr. Agari, the director of the center, Dr. Rifene, who came to the White House last year and spoke movingly about her battle for women's health. I want to thank the members of the American delegation and especially the members of Congress for joining us here, and say that I am particularly honored to be welcomed by Johnny Beckwith because he is the leader of the Network for People Living with AIDS. That is, they have brought a lot of help and hope to Nigeria. And let me say, I want to thank Tayo again for telling us her story and speaking so powerfully for the young people of Nigeria. I'd like to hear them both on a regular basis again. I thought they were terrific, and I know you're proud of them. I would like to acknowledge the contributions, in particular, of one member of the American Congress who is here, Congresswoman Barbara Lee, who, along with Representative Jim Leach, Along with Representative Jim Leach of Iowa, she sponsored the historic bipartisan Global AIDS Act I signed last week, and I thank her and the Congress for their support of the World Against AIDS. This program today is a sober reminder that while it is wonderful that the people of Nigeria are finally free, to be free does not mean to be free of all burdens or all challenges. Indeed, there are challenges so serious that if they are left unmet, your democracy will not mean very much. The fight against infectious diseases is one such challenge. Believe it or not, for all our modern medical advances, infectious diseases still account for 1 out of every 4 deaths around the world. And half the victims, that's why it's good this baby's crying, it will remind us of this. Half the victims of infectious diseases are under 5 years of age. Chiefly because of malaria, mosquitoes will be responsible for the death of more than 1 million people this year. And of course, there is no greater challenge than AIDS. No child should come into the world with such a deadly disease when it could have been prevented. Yet that is happening to millions of African children. No community should go without a teacher, yet teachers are dying and schools are actually closing because of AIDS. No country should struggle to rise out of poverty while fighting a disease that can cut life expectancy by as much as 30 years. Yet that already has happened, already, in some countries on this continent. It hasn't happened in Nigeria, thank goodness. But that should not be a cause for complacency, but instead a call for action. Already there are almost 3 million Nigerians living with AIDS. President Obasanjo has spoken eloquently today and before today about the challenge and his determination to meet it. The only thing I can say to the rest of the people of Nigeria is that you must join with the President and with all the public health advocates and all the citizens groups, all the people that are present here, and the people you represent to help. AIDS can rob a country of its future. I know you are not going to let that happen to Nigeria. I also want to acknowledge that this is not just Nigeria's fight or Africa's fight. It is America's fight and the world's fight, too. I hope the wealthier countries will do their part first by supporting our initiative to speed the development of vaccines for AIDS, malaria, and TB. Just a month ago at the G8 summit in Japan, at which President Obasanjo appeared, we mobilized billions of dollars to fight infectious diseases with the development of vaccines. In addition, we have to do more to support the efforts you have going now. This year, the United States will provide $10 million to support your efforts against AIDS, 3 times more than last year. Nearly $9 million for polio eradication, $2 million to help you protect your children from malaria by distributing bed nets. I must say, that bed net that I saw outside this building when I came up, it has to be the biggest one in the world. But it certainly made the point, and I congratulate you on it. I'd also like to thank the president of the Packard Foundation, Richard Schlossberg, and the others who are here from the Packard Foundation. Where are they? Stand up here. There you go. Thank you. Over the next 5 years, Packard will make $35 million in grants to improve the reproductive health of Nigerian women, and I thank them. We will also continue to support other education and development initiatives, including microenterprise loans and greater access for technology and education that will help to develop the capacity and the willingness and the understanding among children and among women to do what is necessary to avoid the most dreaded diseases. We know, as your president has just said again, that it will also take leadership from Africa. Last April, President Obasanjo convened a malaria summit, bringing together 44 nations to Nigeria and mobilizing the private sector. And next year, as he said, he will host African leaders for the summit on AIDS. Later this year, Nigeria will join 17 African countries for 3 polio national immunization days. Millions of children will be immunized in the largest synchronized health event in the history of Africa. Thank you for that. I'd also like to thank Rotary International, the World Health Organization, UNICEF, and the UN Foundation, and most of all the volunteers for helping in this cause. And I see we have a lot of people from Rotary here today. Thank you very much. That is the kind of volunteer organized help we need in the fight against AIDS. Someday a vaccine will come. We must help it come faster. Yes, there must be more done by the wealthy countries to get you medicines, especially those that will keep AIDS from being transferred from mothers when they're pregnant to their newborn babies. And we will help you do that. But let's remember something. There is one thing quite different from AIDS and most killer diseases. AIDS is 100% preventable if we are willing to deal with it openly and honestly. In every country, in any culture, it is difficult, painful, at the very least embarrassing, to talk about the issues involved with AIDS. But is it harder to talk about these things than to watch a child die of AIDS who could have lived if the rest of us had done our part? Is it harder to talk about than to comfort a child whose mother has died? We have to break the silence about how this disease spreads and how to prevent it. And we need to fight AIDS, not people with AIDS. They are our friends and allies. I admire profoundly the strength of Nigeria's religious traditions. But the teachings of every faith command us to fight for the lives of our children. I'd like particularly to thank the Muslim Sisters Organization for recognizing that and for their many good works in this regard. Let me say that the good news is we know this can be done. AIDS infection rates have dropped dramatically in our country, but they also have dropped dramatically in some places in Africa. If Uganda and Senegal can stem the rising tide of infection, so can Nigeria and every other African country. I am amazed at the courage of the people of Nigeria in struggling against the oppression that you endured for too long until you got your democracy. I urge you now to show that same kind of courage to beat the tyranny of this disease so you can keep your democracy alive for all the children of Nigeria. Not let all the gains that have happened in Nigeria and throughout Africa be destroyed by a disease we can prevent if only we can get over our reluctance to deal with the uncomfortable aspects of it. These children's lives are at stake, and they are worth a little discomfort by those of us who have already lived most of our lives. Thank you, and God bless you. Applause, and give Toya another round of applause. She was great.